Good morning, everyone. Study of community. Previous class we had been learned that urban, rural. Urban means city. We had enough knowledge regarding healthcare facilities in rural. Today we have to start with healthcare facilities in urban. What are the differences? The healthcare availabilities. We're going to learn. New healthcare system available in cities due to modernization. Modernized healthcare services, mainly multi-speciality, super speciality, then private hospitals, corporate hospitals, including Apollo, Ames, Forts, then charitable hospitals. It's a hospital having charity, providing free medical services. Then government healthcare services. National Urban Health Mission is a mission to promote health status of people in cities. Public-private partnership PPP activities. Various government program implemented through private hospitals, including immunization, family planning, etc. UHC, Urban Health Center. Important health practices are immunization, health education, health promotion, nutritional services, sanitation, pollution control, which is important in cities, safe water, provide necessary health infrastructure and medicines, delivery of specialized healthcare services, timely supply of essential medicine under National Health Program, implementation of family welfare program, family planning program in urban city. Healthcare program by various departments. Allied departments, first department, Department of Urban Development, having joined hand with healthcare department and implement various programs. Department of Health and Family Welfare. Department of Women and Child Development focus on women health and child health in cities. Then Department of Water and Sanitation. Clean water is essential, as well as sanitation, clean environment. Next phenomenon in cities that slum. We know that Mumbai, Chennai, Calcutta. What is meant by slum? Etymology, it is a Slavic word meaning room, which evolved to back slum around 1845, meaning back alley. So slum nothing but street of poor people, underline this, street of poor people. Definition: heavily populated urban informal settlement characterized by substandard housing, lack of reliable sanitation services, supply of clean water, and reliable electricity, timely law enforcement, and other basic services. Underline lacking. What are the lacking? Sanitation, water, clean water, electricity, law enforcement, etc. Look at this picture, nearby water. Causes: rural urban migration, urbanization, poor housing planning in cities, colonialism and segregation, poor infrastructure, social exclusion, then economic stagnations, which means poor people difficult to access the services, economic services. Look at this picture. Islam nearby buildings, multi-story building, but nearby Islam is Mumbai. Informal economy, poverty, politics, social conflict, natural disaster, these are the main causes. Characteristics: insecure residence, substandard housing, overcrowding, inadequate infrastructure. Risk or effects: first, diseases is a major factor, communicable diseases mainly. Vulnerable to natural and natural hazards, for example flood, natural hazards. First affect the slum in cities, Chennai, Mumbai, as we had history. Unemployment, informal economy, crime is major phenomenon in slum, violence, child malnutrition, etc. Then measures to reduce: slum removal, slum relocation, one place to another place, safe places. Slum upgrading, that same place upgrading the housing facilities. Urban infrastructure development, public housing. We know that when you go to Mumbai, we could see that there nearby slum, the public housing for slum people and resettlement. So next we are going to detail about regional community. What is meant by region? We should imagine regions in India, North India, South India. Definition: it is an area which has locally having specific geographical character, certain common properties of soil, climate, vegetation, agriculture, and technical exploitation. For example, North Indian people, South Indian people. Region: South Indian soil is that favorable to rice production. North Indian soil favorable to wheat production. That's why different changes. Keywords: geographical characters, as well as soil, climate, vegetation is concerning the regional classifications. Types of regions: physical regions according to geographical characters, metropolitan cities, sectional region, folkways, administrative region, political boundaries, and group of status region, physical similarities and homogeneity. Regions in India under the Reorganization Act 1956. India have been classified into following regions. First region, North Zone, which means North India, Jammu and Kashmir, Punjab, Rajasthan, UP, Delhi. Then West Zone, Maharashtra, Gujarat. East Zone, Bihar, Assam, Orissa, West Bengal. Then South Zone. We are living in South Zone, mainly Tamil Nadu, Kerala, Andhra Pradesh. Students, this is a legislation, is a landmark legislation. Reason is that various state boundaries are changed after 1956. For example, Kanyakumari district is a part of Kerala till 1956. After this legislation, this according to language, this change the boundaries. Not only Tamil Nadu as well as in Kerala, the Tamil Nadu and Kerala as well as in other states as well as. Look at this. So this is a map express regions in India. Look at this: north, south, east, west, and express different colors. Then regional problems, physical problems. For example, South Indian people experience may be so hot. North Indian people experience so cool due to nearby, away from equator. Then biological problem, mainly vegetation, agricultural issues, as well as diseases is different. Then social problems is differ from region to region. Then geographical problem, for example, hills, jungle. Northeast India, there is mountains, people nearby, and which create the communication problems. Then cultural problems, by means of the material and non-material available. Then regionalism. As well as we need to think about healthcare problem is differ from region to region. For example, South Indian people more favorable to diabetes due to rice, and North Indian people just away from diabetes due to the wheat. Then regionalism ism means feeling of their own regions. It's a political ideology defined as focus on interest of particular region or group of region, whether traditional or formal, political division, administrative divisions, country subdivisions, and sub-national units. Look at this different regionalism. India is a political ideology, North India and South India. Causes of regionalism in India, mainly geographical factor. For example, South Indian people having different problem than North Indians. So this one program is not fit for the whole country due to geographical variable. Second, historical and cultural factors. Indian history is different. North Indian history is different from South Indian histories. For example, in South India, having lot of schools and colleges. Due to British rule in India, South India built a lot of colleges and schools. So South Indian people saw the wealthy and lot of facilities in mainly education concern. As well as in North Indian people, lack of these educational facilities due to this, the history. Then caste and religion. For example, caste issues is more in various regions. Then economic factors, production, mainly agriculture. And North Indian agriculture is different from South Indian agricultural productions. Then political administrative factors. Look at this picture map express about South India, Madhya Pradesh, Bihar, aims, influence and political power, mainly political. For example, South Indian politics and North Indian politics. Then decentralization, which is decentralization a main aim, which means every section, every regional people need to take their own decision to fulfill their needs. Then state rights, then greater degree of autonomy, sovereignty, then separatism, independence, promote democracy, which is the essence of democracy, diversity and uniformity. We are different regions, but we are one on the basis of democratic principles. Then diversity and uniformity, it's as we have discussed. Then types of regions. According to national regions, then international regions. The national means within the India, as we had been learned according to Indian reorganization legislation. Then international means for example Asians, Americans, Europeans, like this. Then impact on health, physical health, mental health, and social well-being. Physical health concerns the communicable diseases as well as non-communicable disease by means of various regional factors, as well as non-communicable disease as we have discussed in diabetes mellitus. Then mental health problems is differ from region to region. Then social health. Social well-being is better in educational area. For example, South Indian people may more this well-being than North Indians due to educational factors. Then difference between urban, rural. Look at this picture. Can you see this? Urban buildings only. Rural, there is no building, only a few houses and cultivation, agriculture. Urban, social heterogeneity. Heterogeneity means multiculture in urban, but socio-homogeneity, few culture. More social distance, less social distance, artificially growth, natural growth. Then urban rural. Look at this. Pictures are available, wonderful picture, easy to understand. Then urban, rural. Emergency and speed, but in rural, peace and simplicity. Urban, social control by formal means, as we had discussed. Then rural, social control by informal means, by means of families, religion, etc. Then urban, rural pictures. Urban settlement are defined by their advanced technology and is not natural. But rural settlements are based on more natural resources and events. Urban, look at this, pollution. In rural, there is no pollution, natural one, comparatively. Urban, rapid social mobility, but rural, slow social mobility. Urban, more individuality, but in rural, less individuality. Urban, lack of community feeling, but rural, having community feeling, which means sentiment of living in rural places, village people. Look at these pictures, wonderful pictures, rural and urban. Then urban, lack of unity in family, but rural, more unity in family. Urban, more density of population, but rural, less density of population. Urban, nuclear family, but rural, joint family. Urban, less faith in religion, rural, more faith in religion. Urban, more pollution, but less pollution in rural. Look at these pictures. Urban areas include towns and cities. Rural areas include villages and settlement. Urban settlements are proper planned and settlement, but rural developed randomly on basis of natural vegetation and fauna, which means more natural places and more vegetable agricultural places people living for nearby water availability as well as the soil favorable for cultivation, etc. Urban rural, look at these pictures. So I would believe that we have enough knowledge what is meant by urban, what is meant by rural and their differences. Mainly we are nurses need to think about the health status is differ from urban to rural. Then town. What do you think about town? Town is a human settlement larger than village but smaller than city. So in between village and city. Look at this. This is a town. Types of town. Infantile town with a no clear zoning. Second, juvenile towns which have developed an area of shops. 3. Adolescent towns where factories have started to appear. Then early mature town with separate area of high class housing. 5. Mature towns with defined industrial, commercial and residential area. So what do you think about it? Classified according to their, the biological terms: infantile, juvenile, adolescent, early matured, then matured. When town mature, what will happen? After the town mature, what will happen? The town become a city, which means is urban. Is urban, yes. Look at this town. Then characteristics of town: smaller than city, bigger than village, family system, joint family, nuclear family, extended family, every type of families. Education, middle level of educational status. Ecosystem, less pollution than city or urban. Then economic activities, industrial as well as agriculture, as we had seen pictures, this nearby land available. Then political system, governed by municipalities, mainly concerning the town panchayat. We need to think about nearby we are living in village panchayat, others living in town panchayat, others, municipalities. So town panchayat as well as municipalities are concerning the town. Then infrastructure, educational, economic and physical structures are more than the villages and less than the cities. So which is a phenomenon of town in India. Then community development, project and planning. Definition. The Planning Commission of India has defined community development as attempt to bring about a social economical transformation of village life through effort of people themselves. Keywords: attempt to bring about social economic transformation. Underline. Most important word: effort of people. So people participation to develop the community. Then levels of community development: first level, government level; second, private agencies and institutional level. Aim: integration or integrated development, socio-cultural, economic aspects. Second, fullest development of available materials and human resources. Third, development of sense of responsibility and awareness. 4, improvement of initiatives, the innovative ideas. 5, development of agriculture, animal husbandry and cottage industries. 6, development of social life, communication, health, sanitation, housing, education. And 7, women and child welfare. So these are the main aims of community development in India. The main target area of projects and programs: first is that agriculture and related matters. Second, irrigations. Third, communication. Four, education. Five, health. Six, supplementary employment. Seven, housing. Eight, then social welfare. Then training to mainly youth, training to youth and women. Then different methods of CD, community development, women self-help groups, community capacity building, community-based participatory research, social capital formation, asset-based community development, ABCD, community economic development, CED, sustainable development, then community driven development. Driven means motivation. Then faith-based community development. So this is faith-based is very important, which means religious base. The belief of the people, how people believe, that oriented development is essential for well-being. Then participatory planning, which means people participate to plan their own communities and develop. Then language base. Next, this is very important one, language. For example, what language they speaking, that based development is essential. Then addressing the issues and challenges of digital devices, focus on the educational components, community development. Then role of nerds in community development we will be learn next section. Now discussion time, questioning time. Subija Sujan, Subija,
Sir,
can you define regional community? Define regional community.
sir, regional communities defined as an area which has a locally having a specific geographic character, vegetation, agriculture, and technical exploitation.
Yes, excellent answer. Thank you for answer.
Thank you, sir.
Yes. So this section we have to start with role of nerds in community development. First role is that district public health nerds DPHN take part in all district coordination committee. You know, this every program this in the district has been concerned by the district public health nerds. Second one, DPHN will interpret the needs of nursing services. Nursing services in each district, which means in the district, villages, municipalities, towns, etc. Then goes for supervisor visit to PHC. Every villages and periodically go to supervisory visit and concerning the healthcare services. Fourth one, nurse keep constant contact with teachers. You know, the school health program, mainly the school health nursing programs, and educate the teachers regarding the hygiene, mainly the sanitation. 10 commandment of hygiene. Keep by the students in the schools. Fifth one, increase students' awareness on health and related issues. 6, immunizing the child. 7, promote the village community health. 8, building a healthy village community. Look at this picture. Polio eradicated from the society. by the role of nurses in the community development and primary health care, health for all. Next is new concept is that health, belief, practice and home remedies. Every community people having different types of health belief and practices. What is mean by health belief? Belief of individual towards health and illness. Person having negative belief towards health as causing the illness. If a person having positive belief towards health, experiencing good health. Then belief towards diseases. Mainly considerable population in India having superstitious belief towards the diseases and claim having positive belief towards the disease. Get well, reduce the intensity of diseases. A negative belief towards disease cause to the strengthening the disease intensity may be increasing and difficult to well-being and get well. Then health belief model only available theory. HBM is a psychological model attempt to explain about predict health behavior. Focus on attitude and belief of individuals. I believe that this you may be learned in this fundamentals health belief model. The history is that this model was in 1950. Social psychologist Rosenstock works in US public health services. Then developed based on operant and cognitive behavioral therapy. Look at this health belief model is a modifying variable, perceived seriousness, perceived suspectability, perceived belief versus perceived barriers, perceived threat, self-efficiency, cost to action, and likelihood of engaging in health promoting behavior. Then premises of this health belief model, action. Individual will take action, control ill health. Condition if they regard themselves as susceptible to conditions. Second, believe it to have potentially serious consequences. They believe a course of action can reduce the susceptibility and seriousness. The fourth one, they believe the cost of actions are outweighed by its belief. The components of health belief model: perceived susceptibility, perceived severity. The note, the combination of these is the perceived threat of the health conditions. Emotive responsive is fear. Then perceived benefits, perceived barriers. So this is psychological cost to action. Then additional components: self-efficiency. Next, where do the intervenes? Educate about threats, fear appraisals, educate about coping, health education, then evaluating HBM. Coping efficiency is the most important component. So this is a most important. The reason is that the people should be believed to get away from diseases and positive belief towards the disease, which is essence of this curative effects. Next, self-efficiency, most influence component for health behavior. Then perceived severity, health behaviors are long-term. Perceived vulnerability often influence endurance but not behavior. Then what about other motives for behavior other than health? These motives appears untapped for explaining behavior. Then applications, the health belief model. Please choose a health behavior and population. Assume you are an specialist constructing to develop a pursue communications, poster, news, advertisement to improve health behavior for populations. So the main concerning this is a health belief model, try to promote the health, positive belief towards the health and illness. Create message that include severity, suspectability, response efficiency, self-efficiency for the target population, in the community mainly. Then traditional medicine, look at this. This every community having the different types of traditional medicine. For example, villages having these medicines in urban setting, rural setting mainly. Belief in corporate plant, animal, mineral based medicines, spiritual therapies, manual techniques, exercise, applied suggestibility, combinations to treat, diagnosis and prevent the diseases. Combination with treat, diagnosis and prevent the diseases, which means this traditional medicine mainly concerning the main factors, spiritual therapies. Then animals, plant has used to for medicines. According to WHO, home remedy. Home remedy is a treatment cure the disease or ointment that employs certain species, vegetables and other common items. Home remedies may or may not have medical properties. They treat, cure the diseases. Students, this should be underlined. May or may not the medical properties. The various plant and medicines the people believe to use in home remedies to cure the disease. But maximum is that there is no scientific evidence, only having placebo effect. Look at this home remedies. Effects of home remedies. Many are merely used as a result of tradition or habit or because they are effective in inducing the placebo effect, as we have discussed. Effectively treat ailments such as sprains, minor lacerations, headache, fever, even the common cold. Look at this spices used as a home remedies. Then practice and home remedies. Traditional medicine in treat chronic illness, culturally diverse child rearing practices, Indian Ayurvedic medicines, alternative medicines, herbal medicines, folk medicines, and natural medicines. Look at this face mask for glowing skins. Is these all the use as home remedies to well-being. Look at this home remedies for diabetes. This among some spices are available. Nowadays have been research conducted by nurses as well as medical professionals. How much medical are the medical efficiency available are. First is that look at this. Tulasi, alsi, neelamberry, dalsini, green tea and drumstick leaves and Ceylon husk. Then bitter cord, neem, Indian blackberry. So these are the use for the diabetes as home remedies. green tea, drumstick, bitter cord, neem, etc. Nursing and home remedies. Students, we are nurses. Mainly this knowledge used in community health nursing. When you go to villages, first we need to assess what are the home remedies are available in families in village, mainly Indian villages. Every family having different types of remedies, maybe use different spices use. And to assess some spices and some practice is harmful, as we had been learned in culture, harmful cultural practices, use wrong medicines. The nurses need to know about home remedies to prevent harmful unscientific traditional medicines. Example, oil bath to infant. What happened in oil bath to infant? For example, we know that in the infant maybe use oil to input all the, for example, into the nose. What will happen? Aspiration of oils which cause the primary complex and which leads to the child mortality. So we are nurses responsible to identify what are the home remedies are harmful and eliminate it and advise to good medicine and scientific medicines. The importance of study of community nursing. First, nursing assessment. Nurse, these all the knowledge very important for nursing. Nurse should be assessed. Patient coming from which community, whether urban or rural. The nursing diagnosis, which help to better diagnosis, and community oriented care and community oriented treatment and prevention of diseases, promotion of health, community health nursing, nursing management, nursing education. The nursing education is very important for nurses educator, the student nurse coming from which community, whether urban or rural. Maybe urban, rural community students may be different ability than urban community students. So nurses educated should be concerned to assess for student oriented guidance. Then patient and health education, counseling, community oriented guidance, nursing research, problem formulation, hypothesis making, research design, sample determination, tool formulation, data collections, interpretation, analysis, report writing, etc. And all the nursing discipline use this knowledge, the community factors, maternal health, pediatric health, nursing, medical surgical nursing, mental health nursing, community health nursing. Mainly community health nursing is very important. This is a sociology of community. Then, so every specialities, the study of community is fundamental. When you read the books of specialities, we could see that every disease started with the community. For example, particular disease is favorable for particular region or particular community like this. Should be concerned this. In conclusion, the hence concepts such as urban, rural, regional and home remedies in the communities has directly affect or influence health status of people. And these all the concept has been used as a social medicine, which may be called as community medicine. Community medicine is one of the specialty in medicine as community health nursing. So it's essential to apply to every aspect of nursing. Study of community used to solve the social problems, mainly solve the healthcare problems. Study of community is fundamental to promote sustainable peace and development in the society. Review questions. Define following: human ecology, community, rural community, urban community, regional community, urbanization, community development. List the following: types of community, characteristics of community, features of community, of rural, characteristics of villages, features of urban, causes of slum, types of regional, causes of urbanization, rural development project and program, regional problems, project and programs. Short notes: human ecology, characteristics of community, rural community, urban, characteristics of Indian villages. Students, in the examination aspect, characteristics of Indian villages is very important. Changes in Indian villages also is important. Then Panchayat system, community development program, CDP, short form, CDP. Then urban community, features of urban community, urbanization, regional community, community development project and planning, importance of study of community nursing, causes of urbanization, health belief and home remedies. The difference between urban, rural. Essay: define rural community, explain availability of healthcare facilities in rural and its impact on health and health practices. Define urbanization, discuss urbanization, its impact on health and health practices. Students, urbanization is most important. Essay question as well as short notes. Short essay is, so urbanization should be focused. So according to our syllabus, this unit is over. Next we are going to next unit. So next unit, social system and social organization. System studies and organizational studies. So these studies, as a nurse need to know the various aspects to develop your career development. For example, nowadays nurses, after they complete this BSc nursing, you maybe choose other field, allied field. For example, some these nurses maybe choose to civil service examination, civil services. You can join into civil service, and this is important knowledge to understand about what are the organizations and what are the systems in the society. After UG, you can choose best. Introduction. Social system and social organization is part of society. Study of social system and social organization inevitable in sociology. Organizational theories For example, mainly concerning this theory study in business studies, business administration, public administration. Then system theories, society divided into various systems. Then hospital as a social organization, hospital as well as healthcare organization is concerning the nursing management. So the system studies and organizational studies most important for nursing management. The detail about nursing management will be fourth year, nursing management and administration. Detail about social system. Social means share or interaction. System means every system having input, process and output. Just like our human body, For example, urinary system. What are the input? Water. Process happening in the kidney. And output is the urine, just like. Every system having these three process steps. For example, family is a system. What are the input? Father, mother, children's. Good father, good mother, and good children create wonderful family. As well as education is a system. What are the input in education? The faculties, students, and other management can input and create a process to learning process, and output is that create good students and good professionals. In nursing college concern nursing professionals. So which means system study. Every system having a subsystem. Look at this. Social system, individual, group and system. Meaning, they act in accordance with social norms on the basis of their interaction and interrelationship, create a pattern called social system. Keyword, norms, basis of the interaction, relationship. Definition, an orderly and systematically arrangement of social interaction. Plurality of individuals interacting with each other according to shared cultures, norms and meanings. Types and classifications of social system. First type is that political system, educational system, religious system, economic system, familial system. So these are the key systems. So this is also this including the institutional studies and organizational studies. By Morgan, according to classification according to Morgan, savagery system and barbarian system and civilized system. Civilized system. He was a evolutionist, so that according to classified evolutionary classifications. Then based on livelihood, hunting social system and rural social system, which may be called as pastoral. Then agricultural social system, industrial social system. Then Durkheim's classified mechanical social system and organic social system. Sorokin's classify sensate, material happiness. Then identical system, spiritual happiness. Idealistic, cultural system, both material and spiritual. And characteristics of social system. The social system is based on social interaction. The interaction should be meaningful. 3. Social system is unity. The part of social system are related on basis of functional relationships. So keywords: social interaction, meaningful, unity, and functional relationship. Then social system change with change in time, underline change. Is it is quality of social or quality of self adjustment. For example, in the time of process, for example, in the family, in educational system, individuals try to adjust with and maintain this system. 7. It is system of interdependent. The members of the social system depends on each other. Then elements of social system. According to Bloom's view, belief and knowledge, sentiment, what we feel, end goal, objectives, norms are means standard of determining what rights and wrong. Then status role is the position which an individual has in society. 6. Rank equivalent to standing. Then power refer to the capacity to control other. Then sanction refer to rewards and penalties given out by the members of the social system. Then facility means used to attain end in the system. Actor and act. There are two important elements. Act means what are the behavior functions. Actor means what are the members involved in this social system. So these are the elements of social system. Then next is that role and status. The members, what role doing. Then status means their power and dignity of each members in this social system. Then prerequisite of social system we will learn next class. Next class will be next week Saturday, I think. Any change I will be informed. Now discussion time, questioning time. Jivana Matthew. Jivana.
Yes, sir.
Yes. What do you feel about today's discussion? Which knowledge?
Nice class, sir.
Yes. Which knowledge your favorable knowledge of today discussions? Jivana, can you list what are the healthcare facilities in urban community? Healthcare facilities in urban.
Modernized healthcare services,
Excellent. Yes.
corporate hospitals, charitable hospitals,
Yes.
private hospitals, sir, corporate hospitals, government healthcare services,
Yes.
National Urban Health Mission,
Yes.
public-private partnership activities.
Okay. So one of the information is that regarding the urban in India concerned, the health tourism. Health tourism means this foreigners come in India to getting well. For example, surgery concern. For example, these thoracic surgeries. Okay, okay, students. Have a nice day. Enjoy the day. Thank you all.
Thank you, sir.
Yes.
Thank you,
Thank you,
sir.
sir.
Okay. Thank you.
Thank you, sir.
Yes,
Yes, sir.
Krishna. Yes, Anu, Maria.
Thank you, sir.
Thank you,
Yes,
sir.
Nisha, Reshna.
Thank you, sir.
Yes,
Thank you,
Abhirami.
sir.
Yes,
Yes, sir.
yes,